Most individuals are led to believe that cholesterol is the primary culprit behind heart disease. However, this simplistic view doesn't encompass the full picture. Heart surgeons, for instance, often recognize a deeper and more insidious issue at play: epicardial fat. This hazardous fat, unlike the more visible subcutaneous fat, clings to the heart and coronary arteries, silently wreaking havoc. Epicardial fat is not a passive entity. It actively contributes to heart issues. This metabolically active fat releases inflammatory compounds that infiltrate heart tissues and blood vessels. As this harm occurs locally and immediately, the repercussions can be severe and often unrecognized until it's too late. Understanding what triggers the accumulation of this fat is essential for heart health. One significant factor in the accumulation of epicardial fat is chronically elevated insulin levels. High insulin fosters fat storage, especially around internal organs, leading to a dangerous buildup. Insulin resistance, a condition where the body's cells fail to respond appropriately to insulin, is often at the root of this problem. When the body compensates by producing more insulin, a vicious cycle of rising insulin levels and further fat accumulation ensues. Identifying insulin resistance doesn't require advanced testing. Common indicators are often visible. Men with waistlines over 40 inches and women over 35, as well as individuals exhibiting skin tags, high triglycerides, or persistent cravings, are at heightened risk. The foundation of insulin resistance ties back to dietary choices, as refined carbohydrates and sugars take center stage. Yet, hidden culprits like seed oils can be just as detrimental to health. Seed oils, often mistaken for healthful options, are heavily processed and chemically altered. After ingestion, these oils disrupt the body's insulin receptors and can remain embedded in cells for prolonged periods. The excessive consumption of seed oils can stifle efforts to reduce carbohydrates, perpetuating insulin resistance. To safeguard heart health, it is imperative to substitute seed oils with healthier fats like butter, ghee, olive oil, and coconut oil. Beyond dietary shifts, lifestyle alterations also play a critical role. Strategies designed to lower insulin include adopting a low-carb diet, limiting meals, and embracing high-intensity interval training. Cold exposure serves as an ally in combating epicardial fat, demonstrating that effective heart health strategies can be both innovative and natural. Simple practices like sipping apple cider vinegar water can also bolster insulin sensitivity and overall cardiovascular health. Like, share, and subscribe to my YouTube channel for regular updates.